So, doctor, as we're talking about the case in Italy, a man has been infected with COVID, monkeypox, and HIV at the same time. So, why did this happen? And is it normal to deal with three diseases at the same time in one person?
As far as I know, Sakshi, it is not surprising. The patient must be a known and a being treated case of HIV first. So HIV does not occur in a day; it is a long-time disease. Super infection of COVID-19 can occur, and in such patients in whom the immunity is greatly reduced, in such patients, the infection with a opportunistic infection like monkeypox can occur. So it is pretty well possible. And as far as I know, if he is under the treatment of HIV properly, so they should be able to manage this COVID-19 also. And monkeypox, which can become fulminant if not treated. So I am sure the kind of Western nation Italy is. So I think they have very well equipped ICUs and good health services. So they should be able to manage. Your initial question, can it occur? It can pretty well occur. Because HIV patients, because they have reduced immunity, they are known to have many opportunistic infections of this kind. So this can pretty well happen and can be managed. Not easily, but can be managed efficiently if properly treated.
All right. Doctor, talking about immunity, as you mentioned, that the person's immunity was not fine enough to deal with all the other two diseases. If you talk about COVID and if you talk about monkeypox. So, how to manage the immunity, how to boost up the immunity if we tend to catch such diseases?
Listen again, HIV stands for Human Immune Deficiency Virus. So, per se, it is a sexually transmitted disease, and in this disease, the biggest all the symptoms are due to low immunity only. So they keep getting repeated respiratory infections, they keep getting repeated skin infections or GI infections. So it keeps occurring. So as far as managing them is not very difficult at all. Even in India, which was supposed to be, or rather feared to be, HIV capital, say around 2 decades back, HIV has actually gone down. So I believe this particular person, immunity, if it is down with proper diet and proper HIV management, it can be brought up easily. Because I know lots of patients who are with long HIV infection are living even in India also, and I believe in Italy also they can live longer if proper treatment for HIV is done.
All right. So, doctor, talking about monkeypox, talking about COVID, if any such disease happens, even if we have seen such cases in India also, I'm sure we have not. But in future, if we see such cases, what precautionary measures should one person take?
You see, we always keep telling our viewers that HIV patients are risk patients. They are always at risk of getting infections. They get infections very easily, and their infections do not become better easily also. So they have to be given proper treatment, proper isolation. We have proper antiviral for COVID-19 also, which we are not using in ordinary people. But in HIV patients who are already immune deficient, in them we use it. And same is true for monkeypox. So we have drugs which we are not using for ordinary people. But for these patients, they are pretty well used. The patient can easily recover.
All right, doctor, we have in the past 2-3 months, we have seen a rise in the case of COVID. After the third wave, after the second wave, we have seen a high number of rise in the COVID cases. So, why is this happening, and what measures should we take to prevent this? Though we have talked about COVID before, but still, why is the cases rising so much?
Sure. Let me tell you, Sakshi, the matter of fact is, people in India at present are taking this COVID fourth wave, or so-called fourth wave, very casually. Very casually, because it is partly because we keep informing the viewers in various channels there is a mild disease. So look at the doctor, if it is a mild disease, why get it tested? I would say even in Delhi, where we are seeing hardly 2,000 to 3,000 cases a few days back, and now they are a little less. They are not less because the infection is less. They are less because the people are not getting tested. So a total casual attitude, partly because of the corona fatigue. It is almost 2.5 years now. People are fed up. कब खत्म होगा, how long will it last. So secondly, government has not put up any restrictions or fines or penalties. I heard that in metro trains it is a must to wear a mask, but I am seeing nobody is using mask. Practically, I would say hardly 20 to 30% patients are using masks. Most patients are not using. So my open advice to general public is that corona is not as yet over. Even if it is mild, it can become a severe or killing virus for people, senior citizens, our seniors who are sitting at home, our seniors who are having some other comorbidities. So if there's a definite reason that we must still observe the corona appropriate behavior, which includes using of a mask when we go out. It means to follow the social distancing. It means we properly sanitize our hands or wash our hands with soap and water, and last, take proper meals and look after your diet so that the immunity is not down. So I would openly recommend that this should be followed, which people have totally forgotten. I can pretty well imagine next 2 months are going to be big festival months, and there are going to be big gatherings, big shoppings. So we may have more infections and more such cases. To avoid them, only corona appropriate behavior. And I always say, go for the vaccinations. Booster vaccinations still free for next 40-45 days. Everybody should take vaccination. People have this apprehension, डॉक्टर साहब फायदा तो होता नहीं है, फलाने को हो गया फिर भी उसने इंजेक्शन लगा रखा था, he still got it. So my answer to such negative criticism is that still go for vaccination. It will protect you, if not 100%, to some extent it definitely protects.